Shanae Nelson looks like a picture of health today.
They've got me running.
Rewind the clock to 2014, Shanae, 32 weeks pregnant, thought she was going in for a routine appointment. A quick check of her blood pressure and nurses put her on her side. She was suffering from severe preeclampsia.
At that point, it was stroke level. They were concerned that I was going to seize at any moment.
The only cure, deliver the baby.
3 pounds, 1 ounce. She spent 1 month in NICU.
An extremely scary time for Shanae, one that would repeat itself 4 years later.
And it was like deja vu.
But this go around, even worse. Shanae developed severe preeclampsia 6 weeks earlier than her previous pregnancy.
When Emery was delivered by emergency C-section, and it was a very traumatic experience in the way that she was delivered.
Her baby's heart rate plummeted.
She was in severe danger at that time.
But so was Shanae, her new doctor telling her bluntly there was a chance she could die.
And that's how he said it. So no compassion at all.
In a turn of events, Shanae's OBGYN came in, stopped the emergency C-section until it was safer to perform the surgery. Her daughter Emery delivered at 1 pound 3 ounces and spent 3 months in the NICU.
I'm convinced that had things gone in the way that they had initially planned, I don't think I would have woken up from the anesthesia.
Shanae's experience is all too similar to other Black women, but it doesn't always have the same outcome.
Pregnancy associated versus pregnancy related.
Dr. Gloria Richard Davis says institutionalized racism is the foundation, and it creates more problems.
Oftentimes, women try and communicate to their patients, to their providers, right? That something's not quite right. They may not know exactly how to convey that, but they know something's not right. And oftentimes they're brushed off.
This was the case for Shanae.
I shared with my doctor that I wasn't feeling well, and it was sort of dismissed as, oh, well, you're pregnant.
Other factors that have a hand in why Black women, specifically in Arkansas, have higher rates of maternal mortality. Where in the state do they live? Do they have underlying health issues? Dr. Chriselle Nash with Arkansas Blue Cross Blue Shield says Arkansas is severely underserved medically.
If something happens acutely and you need to get care, you're trying to get to an urban center, to a UAMS or other institutions, and that can have an impact on your health outcomes.
Studies show that of the Black maternal deaths in 2020, 92% of them were preventable. It begs the question, what's it going to take?
And so by doing research, you're able to give them those numbers.
As Dr. Claire Brown breaks it down, it's a tier approach.
A policy tier and the individual tier. There's a middle tier, the healthcare provider level.
The individual tier is all about women and their support system knowing the symptoms that could lead to a severe maternal event. Then, health policy. A big push now is Medicaid expansion.
By having Medicaid expansion, women who are low income are able to have insurance prior to their pregnancy or in between pregnancies so that they're able to get those conditions under control. They develop a relationship with a provider.
And finally, health provider level. This tier requires hospitals and doctors alike to do the work to create culturally aware spaces.
Having that awareness can ultimately allow for a provider to help treat their patients kind of better.
3 important points that these doctors say will help protect expecting mothers, especially ones at a higher risk. A risk Shanae knows all too well, which is why she urges Black mothers to ask questions and don't be afraid to get a second opinion.
We focus so much on the joy of bringing life into the world, but we don't talk about some of the dark side associated with pregnancy.
In Little Rock, Michaela Johnson for Wake Up Central.